Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is September 16th, Wednesday, and this is our COVID weekly briefing. We've had 534 cumulative positive cases in Missoula County to date. That's up 75 new cases in the last week and 22 new cases since yesterday. We've had 440 recoveries and 3 deaths. One Missoula County resident is hospitalized in Missoula County currently, and we now have 91 active COVID-19 cases, which is nearly triple the number of active cases 1 week ago. We have currently identified just under 400 close contacts. Those active cases and their contacts will remain in isolation and quarantine, and they're being monitored and supported as needed. The state of Montana is reporting 9,431 cumulative COVID cases, which is up 190 new cases since yesterday. There are now 2,104 active cases with 106 active hospitalizations across the state of Montana. There have been 141 deaths related to COVID-19 statewide. As indicated by our case numbers, we're definitely seeing an increase in COVID activity in Missoula County. Our active COVID case rate per 100,000 people is currently at 58, which is up significantly from 33 last week. The state of Montana as a whole is seeing 198 active cases per 100,000 people, which is up from 190 last week. Our reproductive value in Missoula County is still holding below 1, which means that less than one person becomes infected by a person who has COVID-19. And that means that we're able to isolate and quarantine people very quickly, and it's helping to reduce the spread. But as we see our case numbers increasing, we can expect that reproductive value is also going to start increasing. As was announced last week, we are now posting University of Montana affiliated COVID data on our website. You will see with the updated cases today that we've seen a significant increase in cases associated with the University of Montana since last week. We have had 24 new associated cases since last week, with a total of 29 cases since August 12th. We are posting once a week, as the number has been so low that we wanted to make sure that we were protecting the privacy of those involved. If we do continue to see associated cases coming in at the current rate that they're coming in, we will begin reporting those numbers more frequently. The University of Montana associated cases are primarily associated with clusters, and most were identified through contact tracing. Seeing the cases in clusters is a good thing because it means that there are cases that are connected with each other, and they're not cases that are just sporadically cropping up without being connected to another case. We have been working very closely with the University of Montana leadership since the beginning of the pandemic to ensure that we're implementing good mitigation and prevention strategies on the University of Montana campus. They do have specific guidelines in place to protect from COVID spread in the university setting, and we just want to encourage everyone to continue to practice those same strategies outside of the campus in daily interactions with your friends, your coworkers, and your family. The other thing I want to talk about today is events. We've been hearing about events that get organized and then get canceled. Usually when an event gets canceled, it's because the event has been promoted prior to a plan being approved. I just want to revisit that if you're planning an event that includes more than 50 people, it's important to remember that it must be highly structured, and a written plan must be submitted, reviewed, and approved by the health department. This ensures that all levels of protection have been thought through and addressed prior to the event occurring. You can find guidance related to events on our website at missoula.co/cvirus. I also just want to remind everyone that you're going to see a little bit of a change to our website. We're hoping to get our new website launched by next week, and that new website will hopefully be easier to navigate than our current website. So that's it for my weekly briefing today. As always, you can check out our website for the most current data and information at missoula.co/cvirus. You can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so that you get notified when additional videos are uploaded. You can call 258-INFO if you're having symptoms of COVID-19 and you would like to schedule a free test through our drive-through testing location. You can also call 258-INFO if you just have general questions about COVID-19 or want to know what kind of resources might be available for you in our community. And you can follow us on Facebook at the Missoula City County Health Department Facebook page. So that is it for today. Everybody stay healthy, and I will talk to you again next week.